Camera set. Good evening, Mr. Boxbear. Dr. Shadow here has requested that I change your dressing here today. Yes, I'm excited to announce that Shadow really cares about you, but I need to borrow him for 2 seconds. So please, Dr. Shadow, there's no need to worry. I'm going to first and foremost verify your full name and date of birth. Yes, you are indeed Mr. Boxbear, and your date of birth is February 3rd of 2020. Perfect. And do you have any allergies? No allergies. Even better. We can proceed. So I'm going to go ahead and show the audience here our materials. This will be my sterile glove and its package and sterile field. Shadow's going to go ahead and borrow Mr. Boxbear for a second there. These are going to be my 2x2 gauze. There are 3 inside this package, completely unopened. And these are the dressings that Dr. Shadow has ordered for Mr. Boxbear today, along with the saline that I'm going to be using to clean his wound, and the tape, which I'm going to use to apply the new dressing. First and foremost, I'm going to apply hand hygiene before I remove your old dressing, Mr. Boxbear, for 20 seconds here. And I'm going to go ahead and apply these new clean gloves. Well, yes, it is a wonderful day, Mr. Boxbear. And yes, Dr. Shadow does love you very much. He's very nervous in taking you to this procedure, but don't you worry. I will take good care of you and bring you back to him very shortly. So I'm going to go ahead and remove your old dressing here with these clean gloves and my wash hands. And I'm going to assess the blood on your old dressing. As you can see, audience, this is blood. I don't see any drainage. The color looks all right. And I don't smell any odor. So I'm going to go ahead and discard this in a red bag. And I'm going to assess your wound here. And I see that it is well approximated, and there is no redness. So I think it's safe to say we are ready to proceed. I'm going to go ahead and remove these clean gloves while I get my sterile field ready. Alright, first before the sterile field, I'm going to lift the saline around the outer edges to make sure they're not contaminated. And I'm going to leave the lid facing up to prevent contamination. Now I'm going to open my sterile field, keeping my fingers on the 1-inch barrier provided to me, as you can see, audience. And I'm going to remove the package of the 2x2 gauze and drop them onto the sterile field before I apply my sterile gloves. I'm going to discard the wrapper. Here's the dressing. Open it from the outer edges and use the 6 inches to drop it onto my sterile field without it coming across the 1-inch barrier. I'm going to unwrap this new dressing, and due to its size, we're going to leave it upside on top of this package to maintain sterileness. And now I'm going to apply the sterile gloves. First, I'm going to apply hand hygiene once again for 20 seconds. And I'm going to apply my dominant hand first by only grasping the outer cup. Wiggle it in there. Hopefully it doesn't rip on me this time. Perfect. And I'm gonna tuck my hand in here on the outer cup, leaving my thumb out. And I'm gonna squeeze my other hand in there. Just gently so it doesn't rip. By only touching the outer cups. And now I can adjust my fingers without touching my wrists, or else it would not be considered sterile. And now I will proceed to clean your womb. First and foremost, I'm going to grab the first gauze with my right hand and the saline with my left. And now my left hand is no longer considered sterile. I'm going to pour the saline onto the 2x2 gauze. I'm going to clean the center first, from distal to proximal, and discard, keeping my hands above waist level. I'm going to proceed to do that with this gauze. Now I'm going to clean the top, distal to proximal, and then discard. And now we're going to clean the bottom, distal to proximal, and discard. Awesome! You did awesome, Mr. Box Bear. We're almost done. So now, I'm going to go ahead and not use my left hand when applying the dressing because it is no longer considered sterile. We're going to drop this piece right here. Right like that. Perfect. And then we're going to use this to finish it on up. Sterile procedure is done. I could go ahead and apply tape onto your brand new dressing, Mr. Box Bear. Congratulations, you did it. We're gonna try to put the least amount of tape onto the skin for the comfort of the patient, of course. On the outer edges and the top and bottom. And yes, Mr. Shadow will be very happy to get you back, I'm sure of it. He is already playing with you in the background. Last piece of tape here. And then I got a piece of tape here, already written, with the time, date, and my signature. I'm going to go ahead and place it right here on top of your new dressing on your abdominal section. And here it is, the brand